According to the American Academy of Pediatrics, childhood mental health concerns have been rising for the last decade. In 2018, suicide became the second leading cause of death for those ages 10 to 24, and the pandemic has only made things worse. Multiple mental health organizations have recently declared a national emergency for children and teen mental health, calling for more resources to be directed towards solutions. Reporter Maddie Beertemple spoke with North Dakota mental health professionals about how kids' mental health has been impacted over this past year.
More and more kids are going to the emergency room for mental health crises across the country.
For the age group of 5 to 11, it has increased at least 25% compared to 2019. And for the age group from 12 to 17 or so, we have seen like at least 30% increase in ED visits.
CHI St. Alexius pediatric hospitalist Dr. Parveen Wahab says the pandemic has contributed to the problem.
Restriction in mobility, social isolation, their daily routines have changed quite a bit. Online schooling, they're not able to interact with their friends, restricted fun, parental stress.
Those at CHI St. Alexius say their children's mental health unit is at capacity and they are in desperate need of mental health resources.
I was told that the unit is full, which means the kids coming in through the doors of the ED or as a direct admit, they will have to be turned away.
While telehealth options have helped, Dr. Wahab says it's not enough.
Has that helped the problem at all?
We need more.
Those at the North Dakota Federation of Families for Children's Mental Health also say the resources haven't caught up with the need. That's despite a 2020 national survey finding a 200% increase in the number of people getting a mental health screening.
Do you think there's enough resources for the need?
Currently, there is not. The state is doing a lot to put infrastructure in place, but a lot has not been able to be implemented yet.
Those at another mental health resource for families, the Village Family Service Center, are seeing a similar trend too.
We see a lot more anxiety with children, and definitely we've worked with kids that have really had a hard time actually going back to in-person learning.
Mallory Schaefer says parents can help by talking with their kids and modeling good behavior.
There is obviously the pieces of the anxiety about getting sick. Going somewhere and getting sick. A lot of how that's impacted is how parents handle things as well. So kids really feed off of and go by what their parents, how they're handling it, what they're talking about.
Schaefer also noted that part of the increase in visits could be because the stigma surrounding mental health is slowly starting to improve. Reporting in Bismarck for KX News, Maddie Beertemple.
If you or someone you know are in need of mental health resources, we have information linked at kxnet.com.